Guru bagenzi board of directors Rwenzori, medical director Rwenzori, staff, hospital administrator, the choir, and in our way, a job so Hamu Corporate Guru Rwenzori Virika Ikirize Evangelio Gambo Isapi Gambo Chokubanza Samaka Ruhanga Icyakabiri kwikiriza kandi cyakasatu kizibwa Simaga Ruhanga Ahura Rwenzori ko kama yakirize abagenge 10 wakawa ni bagenda na leo Kristo bamwamira bagamba Yesu mwegesa ukugirira mbabazi kama Kristo wakabaragira ati mugende mureke abanyakatagara ngo bakandi bagenda muhanda bakora kiwewe bakira wamazira kukira omweka mwegarukire ali Kristo usima Kristo yabaguzi abakiziwe Rabeli 10 omwenda uraha uzoki abwachi omwenda utagarukire usima Kristo zoka mwendo ukaba Yudaya Kristo akali Yudaya weki wakaba wundo watekeleza kuna msaidia akiza mtu wetu ubundi akabaza hagati y'abagamba niswi kudoke hati kinyakuru hazimero bage ntekeleza ukabadili kukiriza muno ubundi bakabaine okwenuba nubaraba bakabatiziwe bakabine mutumo sasa be umeze twarukiye be muno aliyo icyasobere nabwe batwara kifuru bari hali kama Kristo ingia twine isobora kwegera hali na huno mwenda abukuba abona icyo sanga mu tutu mukama akora bitu bingi musima oli ayagarukire ali Kristo akaba ali mu Samariya akatali ku Yudaya nabwe akana yamanyamu nyo tiseberi tiende mu wihamuka kama Kristo nabweki akangende wewe nzime akaba nokwekudaza akamanyiza ubugiro n'obukizi bwakwe nabweki yagenda nakukiza Ruhanga najumara nabya mu maiso ga Kristo namusima na Kristo akasemererwa muno kurora ngu Omusamariya ono agakire mu maiso ga kumusima yo habulizi omwenda kuli kuraha ndabo bino nibyo kutwonyera manyira utosa mukama mkwakora ebirubi mutoba turufumu Mungu akanyonyi kasoma mkaramira iguru na mbere utuma buruga kasiba Ruhanga akukha utuma mbere nyuma aho abantu mukarora story ka video clip mzee wa miaka 8 kwa COVID namtwala kuwaru nampeka oxygen mwakana barakira doctor muragira bill milioni kesa kusasura msaida akana muziki utabambida kakura ndizo kutakusura mkumu so kusasura mkuramba msanga mweke dukura abwa biro bituniendra abokoba emyaka 8 nkani hicha oboya bwa usa kama na oboya bwa usa kwicha kumera kakubo yoro bisana kwa kare tufa so na weka desvange wetaga tosa kumanyira ebisembo bingi ranga byatwa orwo yoro ukwikiza usa takusasura nasibyo ekisembo ky'obwomeezi okupinaba obwombi tukuruka tubada abagenzi baitu abandi era kano abakasobanura kuhindura abakasobanura kulica obukuru bitanga obukoni kubahindura nabweki muno sima Ruhanga ubumezi bwakabukasume kandi bwatatira simera Ruhanga okisembo iwaro lino yavile nitekerezaho iwaro lino nichuka Kansenimeri Seminary B7 in 71 kwenda sana Mungu kwa kumsuita kwa amani naleta iwaro kwa nitekerezaho Sister Day Ade Yemer no alimomu adabanasa watanzania wala tena anyuma ateni ka omukaba Kansenimeri Seminary kabine tumor etama nyesereti kadagede yongera kwa tuna medical examination tuliweza examination ana akalo Dr. Keller nigamra kwa za wala huko ni akali medical mission system so yani kebiri can remove this thing so iso na bazira bange nithan doctor yansemeza tiuma ya kiham hadi dora yene wewe wengi wa munu ziwe abantu wengi bazaliwa hano. Dr. Joseph Kato Hanambela na staff akazaliwa Rwenzori. Imani hadi wengi wa Rwenzori. So ile sima Ruhanga abwa mjanjabi kuunga mbarara kuno alikubizi nasukana kuwaliza kwine pamoja karibu yo janjaba amaino janjaba ndweza abasaija ndweza abakazi abana n'ibindi abwe kwine ibanja kuno because kusima Ruhanga bari kuno n'ibindi bingi bikamya gukora umuyobozi wetu Virika igihamya cya kabiri okwikiriza mvanye tugire mukama Kristo amusaidie uko bakana msimu kumalira kamugamba imuka wegende okwikiriza kwawe kukozeki ukirize kuru bagenzi bange ukiriza ki kwesiga Kristo kwesiga Ruhanga abagenge bari mwenda barawa batizika ndakana kubikiriza nicyo yabahamiriza kurabona batokera hapo Yesu maigasa utugirira mbabazi exala ibasabire kubikiriza ngo Kristo aina amani aina usobozi nasoro kubatiza drop somo lyo kubanza nalonandikira tuto na msongoro komezwe kwa kabayiniki naeleka duwe mjana lani wakawa takayukire wakawa badoma wali kabura wakawa bahabisiwa beitu naeleka kwa kabini somi za mlingo itema nobangana nebindi naeleka embabazi za Ruhanga mustwatungire hati tufuye abantu bashaka kandi naterera abantu bakaba beberwa tito nibare kwikara kungana babe ningeso nundi izobulizi yabebezi baba gafumeka n'abantu ebi bigufu bijuma yo kwikiriza bijuma yo kwesiga Ruhanga no kumanyira ngo hata muze kufoka abantu bashaka byo manyira abana ba Ruhanga na bwishwe muno bikara ku busine na bagenzi babo okikara bahangane kutinesa nuko bakongera kwikara abana ba Ruhanga ndambu bino ni Dr. Bandi hati kufuba kulinda obusinge engonzi upangane kutinesa omaka gaitu ebikayo tukoramu ekikara kakira ekirwaro ikaba staff manyangu twine obujanzi bukuru okolera abarwaire bakwata n'engonzi tanikira hageta nani chana semera batangiriye awe abandi nasa ngambere mukuri tana ubu nuko mulingo bokutangira abaweire umurweire wakwayizire akatangirwa bulungi natandikira hagetabikira obakweka OPD omunasi akamukwata bulungi kira kweyongera obagenda maiso na doctor with the medical assistant okira kweyongera.
Our chief guest, representing the Director General of Health Services, is Dr. Adako Alex. Welcome you. The Right Reverend Robert Muhiwa, the Bishop of Fort Portal Diocese, Holy Family Virika Hospital Board of Trustees and Board of Directors present, our partners, clients, and staff, distinguished guests, ladies and gentlemen. On behalf of the management and staff of Holy Family Virika Hospital, I warmly welcome you all to our annual health assembly. Today we gather under the theme, improving healthcare together and innovating for a better future. A theme that resonates deeply with our hospital mission of providing quality, compassionate care to the community. So I extend special gratitude to our main celebrant, Right Reverend Robert Muhiwa, the Bishop of Fort Portal Diocese, for gracing this occasion with your spiritual guidance. Your presence reminds us of the role of faith in healing, and actually the work has been made easier. The Bishop has emphasized this key during the Mass, so thank you very much. And we also have to appreciate the Bishop for the great work he's doing, especially in supporting the communities in regard to health care. We all know the Bishop has championed the fight against prostate cancer in the region. It's not news, and we thank you very much, my Lord the Bishop. To our guest of honor, we are honored by your presence. Your leadership and experience and expertise have significantly contributed to the health landscape. Like we said, that improving health care together, otherwise we would have had staff and our patients. But the fact that we have different stakeholders on board, we know we cannot do this alone. So thank you very much, and we appreciate the support rendered to us by the government of Uganda through delegated funds, through secondment of staff, and actually we pray for more. Then our valued patients and clients, your faith and trust in the Virika Hospital inspires us to strive for excellence. Therefore, the confidence you have in our care is a privilege we cherish deeply. Therefore, this is our day. Let's use it, let's get feedback, and see how best we can improve this health facility, especially regarding services, because we are here to serve you and shall also serve according to your needs. Then our directors, staff, your tireless efforts compassion, and commitment to delivering quality healthcare make a meaningful difference in the lives of those we serve. So your dedication is a backbone to this institution. So thank you very much for this great work and commitment that you always give to the institution, and especially serving the communities in need. So I briefly go through the importance of the annual health assembly. The annual health assembly is not a camp. And most of our clients were asking, how about the camp? Do you have this? Is it urology? No, this is not a camp, but it's a social accountability forum that provides a vital platform for us to share our experience, strategies, and feedback with stakeholders. That's why we see different people, the Ministry of Health represented, we see the religious team, we see patients, our partners are available here, so we want to get feedback. And actually, like the MC said, there are papers. These are not interviews, but we need feedback. Because the feedback that we got last year or 2 years ago, that we've used to improve services. And therefore, today we are here to give accountability for the last 1 year. So once you fill these forms, they will help us next year around this time to give you accountability according to what we have requested. So therefore, this is a very important occasion, because as an institution, it helps us not to run this institution in a precarious state, a state where our survival in the future is by chance. And I'm comfortable and confident to say that Virika Hospital has lived for over 113 years because of these engagements. Thank you very much. And therefore, today we affirm our commitment to collaborative healthcare. And as you look at the theme, improving healthcare together, the medical director cannot do anything alone, the staff cannot do anything alone, the directors and the owners cannot do anything alone. And you're the owners of this institution. So it's very important to talk about the challenges. Like any other institution, we always have challenges. But over the last year, the institution has faced numerous challenges, including staff attrition, increased healthcare costs, and other operational expenses. However, despite these hurdles, we've remained committed to providing high-quality health care. So, and we shall continue providing high-quality care according to standards. So there are also key achievements that we've recorded. I'll just talk about a few. Number one, we've continued to serve. It's an achievement you have to cherish. Otherwise, it's your support that we are here. It's through your support that we are here. Despite those challenges, we continue to survive as an institution and to serve you to the best of our requirement. Two, we've also seen implementation of renewable energy initiatives. For example, we've successfully implemented a solar-powered water and energy system in key hospital departments. This has reduced environmental footprints, that's damage, and also reduced on the operational costs. And the more we operate with less expenditure, the more we bring more services close. Then there is also advanced diagnostic capabilities. Like today, we shall be launching our digital X-ray machine. So our new digital X-ray machine enhances diagnostic accuracy and efficiency. I'll briefly talk about it when we come to that area. Two, we have also had a program where we subsidize for the needy clients in the community. We have a project supported by Partnerschaft Gesunde Welt. I don't know if I'm pronouncing it well, but Father Musana will guide me. But this project, we do support the needy under 5s with diarrhea and malaria. We give free service. Then adolescent, teenage, we also have the same project is supporting pregnant adolescent girls. It's not that we are here to support pregnant it's not that we are here to support early pregnancy or adolescent pregnancy. No, that's not the case. But we've analyzed that the fund we have is actually not enough to cover everyone. So we identified which areas, which groups are more affected. And therefore, we zeroed to under 5s with malaria and diarrheal diseases because most of them come here when it's very late. Then also under 5s with diarrheal diseases come with the under 20s with pregnancy complications that are severe. So us having this intervention, we give them an opportunity to come to the hospital without delays. And this helps us also to decongest the government facility.
Okay. My Lord, Akik, Bishop, and the clergy, the Ministry of Health officials, as previously observed, the hospital administration from top to bottom, and my fellow colleagues at work. Good afternoon. Namujja kunyigiriza mbazi olulimi olutoro abokuba nindiwetegereza kurunga ndwana olulimi lwa Dr. Kato lwakumanya olutoro ebingi nyembe mwegeseze byatamanyire you blame me. No Luganda narwo nanyigesawo mpo. The prostate is called katungulu, something like that. So ekyamane kidesere kubazaaho nibe bintu bisatu. Ekyokubanza is a brief about the hospital. Irwariro leitu lino limazire emyaka nyingi muno nerihereza abantu. Kandi abantu bengi baguma bagamba alobo ngenda ha radio mpura ne bagamba irwariro lya Virika likagwa nojja kusanga ibasawo nokalaki abasawo tubaini kandi timu nkoto kandi obo kwija tokumara ndeka kumanya sato takabaineke utakabaina musaho kyamani muno kandi nituraninga irwariro lyaitu na department ibiri. Twine side ya OPD, that is outpatient department, noija ne bakorora ne bakuhereza embazi ne bakujanjaba notaha. Kandi twine na IPD, inpatient department. Department yaitu ne baba rwaire abakuherezebwa ekitabu ebitabu ebikuhingura 205 as of 2024, close to 250 bed capacity. And basically between the department ya general department, between the department ya private department, ndo abarwere baitu abakwesobora habaina akasente bajanjabira kuri ruguru nendo abarwere baitu tugenda kuri ifo aho tujanjabira kandi tukora isaha 24 no kujja saa 6 gwikiro nja kusanga abasawo. Irwariro lino balieta private not for profit mukimanyisaki. Irwariro tiriri ya government kandi tirero kukora magoba mukimanyisa ngo oho kujja kujanjabirwa Virika no ihwaho akasente kataito ako kwikalirwaro nerukoraki netambona kurolera abasaho kusasura amaizi kusasura amasanyarazi nebisikeire bintu nkebe. Baiti irwariro military ya Virika twine obuherezo obutoha obutaihaho bantu sente kandi abantu abezire kutunga obuherezo obo mu butungire tumuhirweho sente. Obuherezo obwo kubanza niyo counseling. Twine ba counselors abakuhingura abatano ne bazana abarwere baitu ne babanjaba kandi nomukimanya ngu n'omurwaire wakubala hawodi omusaha akaleba akebire buli kimu kyona kyomezi kyonka nakyakaba. Just example, nitweta counselor neja nakoraki nabazana ba counselor baitu baine twine free antenatal care we antorolera abakyara abenda na timu enkote eri yokusaza nerolera group endi tukwihaho sente netukebera abakazi abakyara benda busa kandi tubahereze mbaze bakwetaga busa ohireho obakuba nibetagisibwa gukora scan bakora nibetagisibwa gukora scan nibeja kwihoa akasente. Twine at clinic nitujanjaba abantu abakuhangara n'oburwaire bw'omunywerero. We don't call them patients, we call them people living with HIV. Aba abantu nabo ntibajanjabira busa. Twine services skuli embazi yabo nibagitunga kandi tuguma ntibakebera except obakuba baine complications zolese oburwaire obu nibusobora kuba yakasente. Twine free chapel services further way to Father Isingo Maroho anyiri hano twabarongo igwaro tukaliye kwata hospital director Dr. Kato Joseph, one of the doctors Dr. Kato Patrick, one of the counselors Isingoma, the priest of the chapel Father Isingoma. So it's a big team. So tune chapel services kandi tugira misa yetu kyakabiri na Sunday. Then twine na free vaccination services netugema kandi tugemera busa kila muno tukiragema buli cyakatano bwete nebire ibindi tugema kandi numwiza kutuleba mu community oko different places twija kugema abana baitu. Kandi twine na family planning services chonka family planning yetu twine hano terinkeza ezindi eitu bajeta natural family planning ito tukozesa manyankinzo manyabujuma natural family planning kandi abakyara bona abazaliro hano mukimanya ngo ifo ko kubotakatahire bamaze kuzalisa kurungi alo umsahoro kwiza kubaza nayo ule hale kalire mamweta sister consolata mugo teaches about natural family planning and the whole team at large. Then we also have services that people actually pay for at a small cost, and ezindi zona bazibalizehe nyingi radiology, scan, x-ray, kishaka kibalesere, dental services, 24 hours amaino, a well-equipped laboratory. Twine lab yetu ijuire kana abasawo baroni bakoraki nebakora bisasaizi babalizeo. Twine pharmacy enungi kandi yekwahore mebazi kurungi.
Guests protocol observed, fellow staff na abarwaire baitu mwasiba muta kiro kinu mu bwangu ningonza turoreho endwaire ibiri zo mutwe rundi ezebitekerezo eziri kukanya muno kandi eziresere kizibu mu bwomezi bw'abantu. Oburwaire obwo kubanza nikiye kigambi itwena tukira kukozesa on a daily basis oburwaire barkweta stress. So ikigambo kiri kikanya no mbaka ikuru no mubana ori nagamba ndugaho nyonye na stress otandetera bino nyonye na stress bitiyo stress kiki akwikuwa no muntu naso kutugambira what stress is. Stress no gimanyota. What is stress? Kare habo bwire stress tugenda kugiha mu kigambo okwetuntura rundi orjungu no sobara kozese kigambo worry, with stress goes beyond worry ngati ehabwenye kare egiye yetarunungi ngokwera rikiro nkozese kigambo kitari nico maraba mwaba mu following okwera rikira baito kwingure ine niyo stress. So no sobora kuboyera rikirire mpora that is worry. Bitenyikare yawo kakubeta tekana mu bwangu kikahingurana n'urwaro burweire wa stress. So no sango umuntu ayera rikirire baitu kukeraho. So kwera rikiro ku burweire kandi kiretwa ebizibu binge biri mu nyikara yetu. Ebyentasha, ebyamaka, eby'abaana n'ensonga zindi. Kandi omuntu owarwaire oburwaire obu nomumanyirira abokuba stress ino oburorwaho nuho hari abantu abandi batunga kutukumira, abantu abandi baba batungire ekintu ekibataribaniza. Abantu abaraikarire ebizamu, you can have a clear picture of stress. When in exam nyencha, you can imagine what happens. Toso kubyama nka buri kiro oturo ntubura rundi no byama ukataito no simuka abandi okuriya nukurema ebintu nkebe. Weight stress nebaho habwenyikara eyakaire kataito kakubemara ebiro bingi rundi emyezi ekite cha stress tujagieta kintu kindi. And this takes us to the second mental health disorder, kandi buno nubwo burwaire oburukanya muno, kandi it is a silent killer. Nibwo oburwaire oburukweta depression. Depression ningira mutoro tusobora kubweta omwenubo rundi omwetunturo, if I'm correct. So omwenubo, just by na mere word kitukenge so redo burorwa ngo umuntu amazima garta kugonza kuba mu bantu bande nagonza ikare wenka abo kubenyikare muhingurineho ubwa kuba mwana wisomero break time unkege no sobora kumanyira abandi nibazana abandi nibariye babohere bitwe na ikara wenka rubajo neitwa abantu abakura abarhanu. You can reflect the time you were into depression. Usanga nguna mukayawe tokwenda kuriya na abandi norinda abandi bariye bamari abako tokwenda kwikara nabo kandi tokwenda kubaza nabo. So cheyera no ija noriye byawo wenko churire na abandi bakira no nebyikaro bikarama okuba tokwenda abantu bakwike heyi. So loneliness, being alone. Ekindi bano nabo batari banizibwa kuriya either noriya muno rundi noriya kutaito betaite roho no kubyama bundi no byama muno no burorwaho bwingi muno. Kiki yakireterezo omwenu nsongi ibiri rundi isatu ezireta depression. Emungi barzeo stress kakubota gijanja beraheyi ne progressing ne foko omwenu ubo. So prolonged days of stress so inensonga tekwaho wairarikira chaikaraho no marira orweire omwenu. Ekindi abantu abandi batunga ebintu ebitwete ebigwerereza. Ekintu ekyamani kandi ekibi muno kyakubaho. Obundu wahura ngu basi yagwa abana babo babiri basatu bafu. Nobwozika noboruga mu process za bari abantu abandi oburwaire buno bubikaramu. Kuferwa ebyentashya business yashya sente baziba bakunyaga ebintu nkebe bisobora kureta omwenu ubonabyo. Omwenu ubogunu kusobora kureta ku effects of depression. Kiki kisobora kurugamu kakuba omuntu abaye no omwenu ubogo kandi kutajanja birwe rundi atakonyirwe bwangu. First of all abantu abengi abuturora abutukira kweta abarwaire bemitwe rundi abararu kabagenzi beitu abakutunga embazi ha regional referral batatandike kiro kimu abandi bakatandika mpora oburwaire bwa progressing stress ya janjabwa omwenu ubo tugwamanyirwa so muntu yamarira embera zimuhingurineho. Ebinde bisobora kurugamu turora biro bina abantu barwaire oburwaire obumanyirwe nko obwirwaro nenyo abarhana abandi musobora kuba mu category biro bino ntutera omuranga pressure sukari ndwaire zo mutima n'endwaire zindi zikanyira kandi tweka guzansonga ke beitu anse nkoto eri mu bitekerezo byaitu ebi kakuba abandi tutekonyera kigambo cy'ebitekerezo rundi mental health no sanga ngo oburwaire obuno yimukanye cyane bakukebera pressure haiguru kandi bambete bakwambazikire ekyo nibakuhana nibakuterera banzo oterekereze nyikara yawe ogaruke tukupima kakuba bongera bakupima na nyencha na mwezi guri bya haiguru hati tubakudikire yaringa murwaire wa pressure bitukitandikire hanyikare eri ekisane kitwatandika ntutera hari ongire harugamu n'abantu abandi abakomera n'obulwaire obumu n'obumu, pressure, sukari, cancer, nosanga ngu response to medication obundi nayo tekuba nungi kakuba ebitekerezo by'omuntu ogu biba nabyo bitaterekerire.
Nakufuniza kurabamu Wait Bishop, representative of guest of honor, Dr. Alex, directors of Virika Hospital, invited guests, senior management and staff, neinywe aba clients rundi abarwaire n'abajanjabiru hano. Ningoza kijuke bugambo Dr. Joseph agambire bukero kino cyoko kuhembalira sa accountability. Management yakansaba kuraliza the guest of honor Dr. Henry Mwebesa ogunwe Director General of Health Services mu Uganda. Akaba motoka agyolekerize Busega, my Lord Bishop kuija cyoro cyejo President ya Mutera yagamba naenda kumutanga-tangana. So tasobaire nicho atumire Dr. Alex Kujan. Dr. Alex, we are grateful that you have come. Kandi bya President ngoko atalimu koramuza orole nkoko na kahumiza. So abire ine kuleka ekyo kuija hano. My Lord Bishop and the guest of honor nigonza kusima board eyukora nayo iwatwaire kandi balo hano abamo nigonza kusaba kuba kuoleka omanye ngubona balo ngoko watwaire. Aloho Father Jude Kaseija is a member of the board. Council Angela Bahenzire, Honorable Tracia Kumutale, Mr. Christopher Mjuisa is here, and our secretary of the board, Jared Mirembe, Father Joe Agenzere, Father Joseph Musana Agenzere, Mwetu Abairo Hano. Nina apologies as Father Edward Muhumza, Tasobira Kubaho, na Dr. Solomon Asimwe, and Catherine Kemugabo. Bodege wapeire kyalo kandi ekora na amane. My Lord Bishop, I want to report to you that the board is very effective. They have interest and they are hard working. We could never have chosen a better team, or you couldn't have chosen a better team than that. Kandi nyongera kusima na senior management team headed by Dr. Joseph Kato Walhano and his team. Nisaba board tubatere mungara abantu bano abokubita our role is an oversight one, but they do the actual execution. So thank you so much. The staff koyamsurulimi rwa noob beba foot soldier bafi. The staff, and they are working under some hard conditions in some situations, although not very hard, but and one of them is that sometimes the salaries delay. So, but they are always on ground. Wakora na weki tuwasima muno, waza kuwasima maisoga bishop, abukwe hayo kwa. I want also to appreciate the partners, the MD ababalizeho, abandi abihayo bona, bitumbere nyinoho nkamukaga bankwenda wangu kurabamu, kandi kubanza na abo kubanza nubo aba manos unidas abo kuba nubo bakizero no kutuleta hano na children waiting everywhere. Jaja na umebere bamwolekere yatina kwemera, but abantu bano bakatukonyera muno bakatukonyera muno kurara ngo x-ray cyari kitwekere. My Lord Bishop ngoko kabomanyire baitu basobora kutungera sente na muno nsima one of the directors, Father Joseph Musana, abo kura kutukonyera kutuyarandiza na ba manos unidas. Manos unidas rulimi ro Spain ndubanyise mahande emukone yerhamu ito murutoro tugamba emukone ebirukoraki kunabisangana nawe kintu basima kandi sima na children waiting everywhere. Representative wabo nawo mekorera al hano ekinjumanyisa ngo abana balinzire hantu hona balinzira obukonyezi nawe kintu nakubasima muno abo ko x-ray cyari kitwekere kitwari twina kandi cyari kikuzire kya analog nko Dr. agambireke. Tuna kusima government ya Uganda ibyaiti tukumara abo kuba tukikonyara bitete kutuleka ne tukonyara bagibalizeho ngoza kubazaho Uganda Farmers Incorporated kino kitongole kiri kyandikirwe kiri mu Amerika bakatwongera kutuha amaizi akihe kyari kizibu hano baitu hati tukakimaraho kandi ngonza kusima Father Emmanuel Yaruhanga batukonyire okuteraniza n'abantu abo twatunga amaizi ga miliyoni 15 kandi kahikana. Children waiting everywhere bakongera batongera sente zindi kurora ngo kwa amaizi agakora izoba amanu gaizoba bitusobora kuyambisa n'amashanyarazi agabulikiro na weki. Children waiting everywhere, we again reached out to Madam Naomi Correa and we received funds for that. So umusana ukubaguzire mteka amashanyarazi kandi chikora enyuma tukabatungireho nebyoma kuruga mu University of Hoves Belgium kanabyo bukatebwa hano cyakonyara keshyaho amashanyarazi agahumema agabulikiro nagwe cyabo ngondeza kubihayo n'abantu bayingi muno alaba tukonyire bya Dr. Bainabazahe bya oruhumbo burwire bw'oruhumbo and Dr. Kato Joseph was very instrumental in that nebindi. So ningoza basima muno abo kwija kandi inywe abayamsi irwaro ningoza kongera okubasaba umwongera irwaro n'kuliyesiga tongera kulukozesa kandi tusobole no kwa feedback ngo kumwa akora sazo n'icyasemeza muno kura maraka ngo bito cyo twenda kura muno nka body nuko tumanye ngo kuturatwaza kandi no kongera management okora yesemeza nebgambe byingoneze kutwara ubwira bwingi ingoza kubagondeze kire kirungi nisima MD na team yabo kutekaniza kiro kino. I think it is a beautiful day, it's a successful day, and we thank you so much. Nebgambe, I want to take this opportunity to invite my Lord Bishop to come and address the audience. Thank you so much.
Busy schedule overseeing Buhinga Referral Hospital, coming to represent Dr. Henry Mwesa, was dedicated you to be with us. Thank you so much, Dr. Alex. I'd like to appreciate the government of Uganda for the support they give us of the delegated funds, which support us in a special way. And these delegated funds were almost wiped away from the budget of Uganda last year by the different bureaus of our religious foundation bodies lobbied seriously, and that money was restored in the budget. And so we're very grateful. I want you to make our voice reach Dr. Mwesa and the government for that. I'd like to appreciate our board of directors and the leadership of Father Thaddeus Musabe and all the board members. We thank you for working as a team and see that the hospital has reached this far. It's because of your efforts. Thank you so much. I thank you on behalf of the Board of Trustees of the Catholic Diocese of Fort Portal. I'd like to thank management and the leadership of Joseph Kato, the other doctors and nurses, the hospital administrator, Sister Angela, and all your staff. Thank you for working together as a team to offer the services that you're offering to our patients who come to Virika Hospital. I continue to ask you that you also continue to work as a team, although you would have the team spirit, but let that increase so that we're able to perform even to great heights. Continuously use the approach of customer care. This is the language of today. Although it is commercial, but for us, we're not using it to make profit. We're not profit making, but it works if we can be able to attend to every patient with that care that they deserve. I also want to appreciate our partners, like those which have been mentioned by Father Thaddeus as the chairman of the board of directors. I also want to reiterate our appreciation to Manus Unidas, with the support of connection of Father Joseph Mugenyi, John Musana. We were able to get the funds from them to buy the X-ray machine, and also children waiting everywhere. We want to appreciate Naomi for her support always, so that we move ahead. We thank you so much. We also appreciate the other partners who have been supporting us, as mentioned by Father Musabe. I also want to appreciate the different presenters of different topics that have been given to us. Personally, I have learned a lot that I didn't even know from the different doctors, also from the counselor who has talked a lot about stress, depression and the rest. Tukusima mama wawele kutuwaliza kurungi ebintu tukwanyara kulinda intekereza yaitu tutari kwenuba baitu tukore bike bira tukwanyara kulinda ubumezi bwaitu bw'ebitekerezo. Ninsima Kapo yatugambire ubugambo bukuru ebikwataho kubalira uruzaro tuyambisa omubiri omukazi na muno kukengana kati omusajja n'omukazi ebintu bikuru ebintu byataga muno okulinda eteeka obusinga n'omumaka kandi engonza amazima ezitukwanya kuleta abaana munsi ng'ekisembo Ruhanga atwaire engera tuteho bulyo kuserura obwire bwingiho abakuba abantu bengi niwabisibwa bayambisa juma bayambisa enkinzo ekuleta n'okusiisa omubiri kansa n'ebindi ngira ba doctor mujja kutukwanyara kusobora ebintu bino abakuba abantu bengi ndora kansa kutugirira mu nkinzo mu bijuma so tukengese ebintu bino abantu babitantara bayambise natural family planning nuko babenetea kalekusiza sente n'obwiye n'ebindi abarungi nyone ngoza kubasima abaziye kiro kinu kwerekesa yoda kwijahanu kwa naitwe akiro kinu okumanyisibwa kufa Holy Family Virika. Dr. Kato na timu yao ntibasima wale kutwegesa kana kutumanyisa mukora bukasumi hano Holy Family Virika. Ningonza garukamu ebugambo yomukyara Resila twegendereze okura orugambo orukwabisa abantu. Tumanya ngo hati Uganda tuine kwenda free economy, so abantu bene amarwaro bene amaduka gamibazi bateka birango ha radio timanyire nyabafumu afutkwanyiye bunda akintu ko byo manyire amarwaro tugasemeye kuteka biranga radio ebyo kusikiriza abantu, so ati abantu abone orugambo barabanda tamurba orugambo amavirika mendo ari haiguru okumtajyayo abantu bahabisa bagenda buntu okwajanja kurungi no kuja virika barukubi muno bali mukufu so na bwe kutegereza urugambo otukura guno kurugamba abantu abandi okuhabisa laka tumanyire mu Uganda etrumu alumno abantu abatuku baze ibintu nyakuterekeriye no kuza kusisa kandi kuna kintu kurungi no bakisisa so na bwe laka tuongere kuandara uhabuzi otukura radio Jubilee kuri cyakatano kuruga saa 2 ka saa 3 saa 8 yemo abakusobora nuko tumubabuzi kumanya kurungi kufa Holy Family Virika laka tugumizemo kwija kutunga obuhereza oburungi Holy Family nuko tutunga ubumeze burungi obomutima obombiri kandi obwebitekerezo ubone mu kumpuleza abarungi mukama abandinde. Bye. Let me take the honor of
distinguished invited guests for this occasion of today. It has been a very big privilege on me to preside as the guest of honor in this function. Indeed, I was also individually invited to be part of this assembly. This is a very good occasion an occasion in which we interact with the people we serve. I want to thank the church for quite a long time being very pivotal in healthcare service delivery and also other social services in this country. The works of Albert Cook have continued to manifest in this country. Where government had not reached with services, the church and other faith-based organizations reached first and have continued to expand. As government will recognize the role you play. I also wish to thank the bureaus. Your engagement with government really shapes the decision making for the better health of the people. As government, we continue to cherish partnerships and recognize you as the complementary healthcare providers. We provide this service together with you, and we shall continue to do so. Government will continue to ensure that there is a very good working environment and for all players, stakeholders in healthcare service delivery by enabling policies and regulations that are suitable for all. We appreciate the differences sometimes that comes with healthcare service provision, but we cherish the Catholic values, the Christian values as you provide these services. There can be slight differences in whether we value this or that, particularly also in the area of family planning. But we appreciate this, we appreciate all these alternatives which have been provided for the population in this country. We shall continue to provide these delegated funds and support to these hospitals. The idea of ministry is that we provide these delegated funds so that we can be able to provide the services to the population at a more subsidized prices. We shall also continue to support the hospital with the human resource. I think there are human resource that we do post to the PNFP facilities. Actually, the Director General told me to inform my Lord Bishop and the board that he has pledged to post yet another medical officer to this hospital, increasing the staffing capacity. So it's upon the board to follow this up with the ministry. I know this will materialize. Healthcare provision has continued to change with the times, and I like the move the hospital takes to adapt to new technologies and innovations. You are bringing in new technology of X-ray, and this is also in line with the improvements Minister of Health is making to improve the diagnostic capacity, the investigative capacity in all the health facilities in this country, including Fort Portal Regional Fire Hospital. We have moved ahead to bring CT scan services that the population here used to access from very far distances, Mulago, and also when it came later, probably in Barara. And this has been done all over the country. We're also going to have the MRI services so that we improve the diagnostic capacity. We are working very hard to improve the laboratory services. Actually, we also have an accredited laboratory. We shall be able to work together with this hospital to see that the same standards are upheld. Virika is under Fort Portal when it comes to the mandate of Ministry of Health in service delivery. We do supervise this hospital. I have also come here several times. My Lord Bishop, I found this a very comfortable environment for patient care, and it has continued to improve. The hospital is clean and organized. Unfortunately, the first time I came was during COVID 2001, the beginning there, the patient load was less. But I've seen it to continue to improve. We shall continue to partner with you and also see that the services offered are to the quality. We have services that have been regionalized, and this hospital is also able to benefit from that. We are going to have a very big oxygen plant. We have had a small one, but we are upgrading this. All hospitals and health facilities in this region are expected to be able to fetch oxygen from that facility. So, management, when this plant becomes operational, be able to fetch also oxygen from there. Referral services. The ministry has moved ahead to decentralize coordination of ambulances. You can see new ambulances being deployed in constituencies. These are still under the referral hospital. The mandate of the hospital is to direct use of these ambulances. It means that if there's also a patient to be referred from here, these ambulances can be equally accessed. We are all serving what? The same population. An ambulance in Charasozi can be dispatched if there's no nearby one here to refer a patient right from this facility or any other nearby facilities to the referral points. So let's be able to take advantage of these many innovations that are coming by in Ministry of Health. Now, there's a lot of health information and misinformation in public. At times when you travel in buses, somebody's coming up to is advertising a lot of things. In mass media, you hear people are talking about ABCD. But I think as health professionals, we need to come clear and at times also be able to demystify some of this information. I've liked the key messages passed to the sitting here today. Let's continue with this spirit and continue to do so. We have had many innovations and interventions. I can clearly see there are a lot of interventions for child care. There are many interventions for even people who have ventured into funeral services. But something glaring is coming. As the population continues to live longer and we pass health prevention messages, the economy improves, people are likely to continue to live what? Longer and become elderly. The services for the elderly, my Lord Bishop, in this country are what? Scarce. This could be an area we can also venture in to be pioneers. Maybe others can be able to learn. Yeah, healthcare costs are very high. But the general saying is, prevention is better than cure. If we prevent diseases, if we prevent road accidents, these are not diseases, and we prevent other calamities, then we shall have fewer people in the hospitals. You go to Fort Portal Referral Hospital. Today is Wednesday, tomorrow will be worse, Thursday. The lines are too long. and you go to many other facilities. When we prevent and we take these messages of prevention by Minister of Health seriously, and all other interventions that have been levied for healthcare prevention, including immunization services, including the screening services, including use of the nets, and many others, then the burden of healthcare will be reduced both on the households and even the healthcare providers. We should be then able to manage more complicated cases and emergencies. Then the healthcare worker will really have a lot of time to concentrate on a patient and provide the service much better. Lastly, we have just passed the year of mental health awareness. Rather the month, it's October. The theme for this year is mental health at what? Workplace. Managers, let's make the workplace comfortable. I was not able to pick Lotoro very well, but I know I'm going to learn. There are a lot said about stress here. There's also a lot of stress in the workplace. Let's be able to cater for the mental health of the providers, of the patients, and all members of the community. We reduce stress levels, people live comfortably, then all these other issues we see will come to pass. Our region is rated very high in HIV prevalence. It's a preventable disease. I also note that in this region there's a lot of food. Actually, this region can feed the whole of Uganda. But I still receive cases of malnutrition, and we still have malnutrition ward in the hospital. I think these ones should be what? Closed. Then there are issues of suicide. We all have different experiences, but my experience, the cases of attempted suicide and also completed suicide are actually also, it means something is taking place in the community, which community leaders, healthcare professionals should be able to address for us to be able to prevent many of these issues that affect us. I want to thank you very much for organizing this event. I pray let it be organized again. The Minister of Health will have been here fully, but because of other events that came across the Director General, he had to delegate. And here I pass his message, the key message that make a follow-up on his pledge of a medical officer for this facility. Thank you very much. I don't have my time.
Treatment for essential hypertension includes lifestyle changes, such as eating a healthy diet. If you are sensitive to the sodium in salt, your doctor may recommend limiting your intake of salt and highly processed foods. Sodium may cause your body to retain water, which increases both your blood volume and your blood pressure. Other lifestyle changes that reduce blood pressure include avoiding excessive alcohol intake.
Galo. Who's counting? Count for us.
5, 4, 3, 2, 1.
Take the X-ray. So this digital radiography, once I take, I command the switch there and expose. This is a detector. So the image is captured onto this detector, and this is a link between this detector and the computer, and the image will appear on the computer there.
The antennas.
Yes, these antennas. That's a link between this detector and the computer there. So there is no any connection between this detector and the other computer. It is just senses through.
It's a big number.